Dr. DiPaolo, thanks for joining us. Our topic is osteoporosis, and the first thing we always like to do is just get a definition. What is osteoporosis, and how serious is it?
Osteoporosis is a condition of weakened and brittle bones, a condition in which the bone tissue is diminished both in its quantity and its quality. With osteoporosis, the bones are more susceptible to fracture. There's less bone mineral content, less calcium, and the bones are more porous. They're more fragile, more likely to break, so that if you have a fall, you're more likely to suffer a fracture. And it's a serious condition. It turns out that if you're a senior citizen and fall, you have a 20% chance, if you break a hip, of not being alive a year later. Of the 20 to 30% that survive, many of those people require long-term nursing care and never return to their normal level of functioning.
Who's at risk, and what are the risk factors for developing osteoporosis?
There are many risk factors for osteoporosis. There's some that you can do something about, some that you're born with you really don't have a say. For example, your genes. If you have a family history, you can alter that risk factor. If you have a parent or a sibling with osteoporosis, you're more likely to develop the condition. Your sex, men and women, can both have osteoporosis, but it's 4 times as common in women as in men. Ethnicity plays a role. It's more common in Caucasians, certainly occurs in other ethnic groups, but it is more common among women that are of Caucasian descent. And finally, if you have a small frame, you're more at risk for osteoporosis. There are also those things you can do something about, the modifiable risk factors. Importantly, getting enough calcium, enough vitamin D, and exercise. Being sedentary itself is a risk factor for osteoporosis, and also just having poor nutrition, not a good diet, not getting enough calcium, vitamin D, and maybe overdoing it with carbonated beverages like cola, alcohol, more than 3 drinks a day, can leach calcium from bones.
You touched on this, doctor. Can men be affected by osteoporosis?
Absolutely, men are affected by osteoporosis. Currently, there are 2 million American males that have osteoporosis, and the statistic is that for men over the age of 50, 1 in 4 will suffer a fracture at some point in their life that's related to a fall. Certain groups of men are at higher risk for osteoporosis. They have a higher risk than just the average male, and this would include people that have a family history, father, parent, sibling that has osteoporosis, people with chronic medical conditions on certain medications that we know raises the risk for osteoporosis. This would include seizure medications, prednisone, and other steroid medications that are given for inflammatory diseases like rheumatoid arthritis, those with insulin-dependent diabetes, and finally, people that have either poor nutrition or low hormone levels, whether it's low testosterone and, yes, low estrogen, which can occur in men.
Are there symptoms specifically to look for with respect to osteoporosis?
Osteoporosis is a silent disease. It's like high blood pressure. It can get worse year after year with the patient really not having obvious symptoms. And just like with high blood pressure, there's a simple way to test for it. With high blood pressure, we check your blood pressure. And with osteoporosis, we check your bone density. We do a bone mineral density test, a DEXA examination. It's quick, painless, 5 to 10 minute examination, no special preparation, and it's very accurate at discovering the silent disease that you may not know you have. One thing to be aware of, though, is with osteoporosis, one subtle symptom that can occur is some of the vertebrae slowly collapsing. And people will notice that have osteoporosis that their back may start to hunch forward, or they may lose height. If you lose more than 1.5 inches in your height from the time when you were a younger adult, you should see your physician or healthcare provider about getting a bone density test.
How is osteoporosis diagnosed?
It's diagnosed, osteoporosis is diagnosed with using a bone mineral density test. A DEXA examination is the best one. DEXA stands for dual energy X-ray absorptiometry, just an acronym, and it's a test that uses 2 X-ray beam strengths. It's quick, it's painless, it uses a very small radiation dose, much less than you would get from flying from Texas to California or Texas to New York. The test is very accurate at diagnosing osteoporosis or osteopenia, a milder form of bone loss.
Once you have a diagnosis of osteoporosis, how is it treated?
Osteoporosis is treated based on how severe it is and also based on individual factors that we take on a case-by-case basis. If the bone loss is only mild, you may only need to make sure you're getting enough calcium, enough vitamin D, and getting exercise. The type of exercise that we recommend twofold. One is to make sure that you're getting strength training exercise, because resistance exercises like we do with weights, Nautilus equipment, resistance bands, they strengthen the muscles, but they also strengthen the bones. Pretty much anything that you do to increase your muscle mass will increase your bone integrity. Weight-bearing aerobic exercise is the other form of exercise that is commonly advised. You can do that most days of the week. That's exercise that you do upright against gravity. So it includes things like walking, jogging, running, hiking. It doesn't include things like swimming or bicycling. Also, with what recommendations we make for people that have a mild form of bone loss, osteopenia, is to make sure that they're getting, if they're under age 50, 1,000 milligrams of calcium a day, or 1,200 milligrams if they're over the age of 50. And for vitamin D, it's 400 to 800 international units up to age 50, and then 800 to 1,000 after age 50. Medications are usually employed once somebody has osteoporosis, and that is when they are 2.5 standard deviations lower in bone density than the peak density that they should have. So it's pretty much what their bone density is compared to somebody who's a young, healthy adult.
You touched on calcium, and it leads into the question, does taking a calcium supplement help, and if so, which supplements work best?
Calcium intake is very important in preventing osteoporosis and in maintaining bone density once you're an adult or once we know that you have low levels of calcium. Calcium is an essential mineral. That means you can't make it. You have to get it in your diet. And most people don't get the minimum amount that's suggested, the minimum amount being 1,000 milligrams a day if you're under age 50, 1,200 milligrams if you're over age 50. You can calculate your calcium as follows. Assume that you're getting 250 milligrams from the typical diet, aside from what your dairy intake is. Add to that 250 the amount that you're getting from dairy. Read the food labels, read what you're getting from milk or cottage cheese, yogurt, etc. And then whatever you are falling short of that, that's the amount that you may need to take in from a calcium supplement every day.
Are the supplements well absorbed?
Some supplements are absorbed better than others. For example, calcium gluconate and calcium citrate tend to be better absorbed than calcium carbonate. On the other hand, calcium carbonate is cheaper, it's easier to find, and it may be a more practical choice for most people.
Are there other vitamin supplements that might help in treating or preventing osteoporosis?
The main two supplements that people should consider are vitamin D and calcium. There are other nutrients that come into play in terms of bone health. For example, magnesium and vitamin K. Most people get enough of them from their diet. They don't really need to take a separate supplement. But with vitamin D, that helps the intestines absorb calcium, and most people do not get enough vitamin D from their diet. So it's helpful for those people. Of course, speak with your healthcare provider about your particular needs, but it'd be important to consider taking vitamin D with calcium if you have low bone mass.
Once you've been diagnosed with osteoporosis, is exercise beneficial and is it safe?
Exercise is encouraged, but with modification. Once we know that somebody either has low bone mass or osteoporosis, which is the severe form of bone demineralization, we're careful to tell patients to do moderate intensity exercise rather than high impact exercise, and there's certain exercises to avoid. It's a good idea once you're cleared for exercise by your healthcare provider, by your physician, to speak with a physical therapist to help design a program. Exercises they tend to discourage are those that involve too much twisting of the spine or too much bending, which could put extra pressure on the vertebrae, cause them to collapse. And what they'll do is help to design a program that incorporates the types of exercise that we want patients to do. Weight-bearing exercise, light resistance exercise, and 3 things that we may incorporate that are not in the standard recommendation for healthy adults would be exercises to improve balance, posture, and functional activity.
What role can nutrition play in preventing or managing this disease?
A lot of people get into trouble because their nutrition isn't good to start off with. They're not getting a balanced diet, they're not getting enough dairy, they're not getting enough of their vitamin D and calcium, and that predisposes them to having osteoporosis. So one thing is to maximize your nutrition. Make sure you're getting a balanced diet and you're getting those nutrients that we know that you need.
And one bonus question. Once you've lost bone mass, is there any way to regenerate it?
There are some studies that suggest that by doing resistance exercise, we not only hold on to the bone that we have, but we can add additional bone. Those studies vary depending on who does them. The results are not always consistent, but certain studies have suggested that you actually can increase your bone density a little bit by doing that sort of activity, strength training activity that strengthens the muscle, resistance exercise.
And what about medications, prescription and otherwise, for treating this disease?
The most commonly used medications are what we call a class of drugs, bisphosphonates. They are medications that deal with the osteoclast, a cell that remodels the bone. We think of our bones as pretty much being static structures, and they're not. The bone tissue is very dynamic, and you can say that our skeletal system is like a building that's always under construction. We have internal design going on, we're remodeling the outside of the house, and there's a group of cells called the osteoblasts that are bone building cells, and the osteoclasts, there's one set of cells, the osteoblasts, that are the bone building cells, and the osteoclasts, which are the remodeling cells, the ones that tear down bone. With osteoporosis, you have an imbalance. The osteoclasts are working harder than the osteoblasts, and more bony remodeling is taking place than bone building. The most commonly employed drugs are the bisphosphonates, like Fosamax, like Boniva. They slow down the osteoclastic activity. That demolition team that's tearing down the bone will not work as much with that medication. That allows the osteoblasts to help you build your skeleton back up.
And osteoblasts are bone
They're the
building.
bone-building cells. The medication, usually within about 3 years, we see when we measure people with that DEXA examination about a 1 to 2% increase in their total bone mineral content. Doesn't seem like much. All we've done is increased the skeleton by about 1 or 2% in terms of its bone mineral content. But that results in a significant reduction in fracture risk. That little 2% increase in bone mineral content may translate into a 40 to 50% reduction in fracture risk, which is very significant.
Very well. Doctor, thank you very much for your time today.
Thank you.